Thank you so much for joining us on this special broadcast of Health Matters. We're joined by Chante Graham, journalist and award-winning documentarian from New York. Chante, thank you so much for joining us this afternoon.
Hi, Rose. Thank you.
The last time we spoke about how the coronavirus started in the United States and how it progresses. Now we're looking at, in terms of recovery, how the number is growing, and as of today, it's over 1.5 cases recorded in the US,
Yes.
and over 91,000 persons have died. So let's look at that in terms of the number. As of now this afternoon, Governor Cuomo says that there's no new cases as of today. So let's look at that in terms of our person being more responsible, or the healthcare workers are having a better handle of how to treat this.
I think it's probably a combination of both. I do believe some people are being more careful, although I have seen people who are not adhering or wearing the mask. Also, I think you have to take into account the numbers might be reported like by the end of the day. So we might not know that until tomorrow. If if we have new cases, actually, 106 people died in New York yesterday.
Right.
So I think by tomorrow you would know if there were any new cases today, because I guess all the hospitals have to report this information.
Right. There are a lot of home quarantines that have been done or implemented well, in my research, I was a little bit surprised because of so many hospitals, especially in New York, and in terms of the capacity, but the population is so large
Yes.
that they're asking persons who don't exhibit advanced symptoms of the virus to home quarantine. Talk to me in terms of, are you seeing more persons getting severe or being chronic because they're not sure how to handle the symptoms, or they're not such a definite treatment for the virus?
Yes, that answer is twofold, because sometimes we have a lot of New Yorkers, especially a lot of immigrant New Yorkers who don't have health care, who may be scared to go to the hospital for fear of being deported, or you know um, the government agencies looking for them. So they might tend to stay home when they really should go and seek care. I was reading an article, I think it was in the New York Times, about um, a lot of the undocumented workers who will not go to the hospital until it's like really dire, and then if they're living in households with other people, they are also passing it on to their family members. So I think it also depends on, if you have health care, if you are severely, you know, incapacitated, you get to the point where you say, okay, I have to go. But a lot of times people are staying home to try to see how long they could before they actually have to go to the hospital.
I also, speaking with other family members and friends in New York, especially Brooklyn, where you have the largest number in New York, reported cases that is, and deaths, you find that they're saying that going into the hospital is actually a high risk of contracting the virus. Because I had a friend who died a couple weeks ago from coronavirus because his diabetes level was so high. He went to the emergency room, got admitted. A week after that, he was showing sign of the coronavirus. And the following week, he passed away. So are persons being more fearful? Is it from a cause of fear why persons are not going to the hospital? Or is it that of space?
I think it's a combination of both. I definitely think it's fear, because I also know a lot of people who said they didn't feel safe going to the hospital. Also, sometimes I've heard of cases where someone actually went in the hospital for one thing and also came out, not came out, but had the coronavirus. So I think that it's a combination of fear and um, even me myself, I probably wouldn't go into the hospital until I felt it was absolutely necessary because I would be a little fearful myself.
For example, Kings County, that's in Brooklyn, that's an hospital that I know takes persons who are undocumented. And
Mhm.
in terms of not having a health insurance, they still do take undocumented persons. However, they're showing signs that persons are still staying away, persons are still not coming to the hospital. They ask them to call in, they're not calling in until they show severe signs of the virus. So as you were saying before, some persons show that they're fearful of being deported. But are
Yes.
they looking into that issue right now? Isn't it health first? Doesn't health matter over your immigration status?
Definitely, it should be health first, but um, in America right now, it's health versus economy, health versus status. I don't think it's necessarily that's what it should be, but a lot of times the people who are on the ground, they don't feel that way.
Right. Persons are returning to work slowly but surely. Even though a lot of persons were laid off, persons are still returning to work. Based on what you're hearing from employees, employers, are they ready to reopen businesses, or are persons ready to return to work knowing that the virus is still growing?
Well, I was reading a survey and on U.S. News, and they were saying that most, like 46% of Americans, still do not feel safe going back to work. We have upwards of 36 million people who have filed for unemployment in the U.S., and we have recession numbers, and so a lot of companies have not have does not have anything in place yet for the employees to return safely. I guess testing will have to be the number one priority before you're able to let people back into the office. Now, essential workers and people who make deliveries and things of that nature, they don't really have a choice. But the office buildings and people like that are still holding off on bringing their employees back. And it depends on where you work. I'm hearing September. I'm hearing the end of the year. So it really depends on where you work as far as bringing people back. But once again, you have to look at the data and the science, and you have to know how many people actually have it, or else we'll have a major breakout like we did in New York when this coronavirus first started.
Right. I find that persons who work with the city or work with the government, federal workers, some of them disclose in privacy that they're forced to work in terms of they don't have a choice because their services are necessary or needed at this point. Do you hear of any persons in terms of saying to you, well, I wish to stay home with my family, but I have to go to work. I have to be there, not by choice, but out of a demand or a command from the government.
Yes, I do know a couple of people personally who work in office buildings who actually do maintenance and things of that nature, and also transit workers. So they do have to work. Some people are put on a what you call a like a rolling schedule where you work one week and work and off other weeks. But we're finding that this could be also discriminatory because the person that I know said they weren't able to have those luxuries. So once again, people are putting their health, their paychecks in front of their health,
Right.
and it's unfortunate, but people have to make a living. So it's hard to choose between your work and your health for some people.
Right. I know the government established where a stimulus check will be given to millions of Americans. My question is this enough to hold persons over to take care of their families while the economy tries to balance itself out before it starts growing again? Is this enough? What are they doing to supplement those stimulus checks?
Well, right now, there's nothing being done to supplement the stimulus check. Some people have not even received their stimulus checks yet, and there's right now a bill in the House for another stimulus, but it has to pass the Senate, and then now there's contention between the two as far as being having it being passed or not. So right now, Americans are in limbo because if you don't, if you're only getting this one stimulus check and you are still having a hard time getting unemployment, there are still some people who have not been able to get unemployment yet, then people are very susceptible now, and they really don't know what they're going to do. So a lot of people are really having a hard time here in the US.
Wow. For persons just joining us, if you're just joining us, I'm speaking with Chante Graham, journalist and award documentarian in New York, covering the COVID-19 outbreak there. And we want to continue, Chante, as it relates to hospitals. Take us in terms of your investigation of what's happening in the hospitals, because there's many reports as it relates to supplies for the health workers, the treatment that they're doing in terms of helping persons to get better from the coronavirus. What's the latest that you're hearing?
The latest that I'm hearing is that the PPE, which is the protective equipment that the hospital, that the nurses and doctors wear, is still scarce. I'm also hearing that there are not enough tests. I'm hearing this from people who are in different states, saying that they only have a certain number of tests. So I think if the testing isn't there, like they're claiming that it is, if the testing isn't there, then you don't know who has it. So you're just waiting for another outbreak to happen. We have in New York about 61,000 recovered persons out of
Right.
the 350,000 cases that we do have here. So but we still have 22,000 people who have lost their lives, which is a lot. But from what I heard, and I keep the source anonymous, is that the hospitals really are dealing with a lot. There are a lot of patients who are really passing away, and there's speculation on, are these numbers really correct? And from what I was hearing, that the numbers are really higher than what's being reported.
Right, because here currently we have 520 reported cases as of today, this afternoon, that is. And we know that we have 131 recovered cases, and it's growing. And we're on a very smaller scale because our population is way smaller. And we're handling it as it relates to medical workers, health workers. We're doing testing in communities because community spread is one of our biggest challenge. What about in terms of New York? I know the density is so close because of the apartment buildings, especially in Brooklyn. Talk to me in terms of, are they visiting that possibility of doing, in terms of boroughs, they go into boroughs and do community testing?
Well, what I'm hearing is that they are starting to test within the communities. New York One published something today which is breaking down the cases by borough. So and area. So they're saying that East New York, Brooklyn, Far Rockaway, Queens, Flushing, Queens, Coney Island, and the Bronx have the most cases out of New York, and I think the most cases might be in Corona, Queens. So I have not personally seen any testing sites set up, but I don't know. I don't think people are actually coming around, trying to get people to get tested. I have not seen that in my neighborhood. I actually happen to live in the East New York section of Brooklyn, where the death rate right now is about 612 people. And this is not a very big area. So, but I have not seen any testing facilities going up. And traditionally in the hospitals, you have to have a couple of symptoms before you're actually tested.
Right.
So you can't
Be-
just walk in and say, "Hey, give me a test."
right. Because watching the live broadcast of the COVID-19 press briefing with Governor Cuomo today, he's advising for persons to be responsible in that they should get tested if they see signs of symptoms of the virus. But now you're saying in terms of the number of testing, and you have to exhibit a certain amount of symptoms in order to be tested. So I'm wondering if that's mixed signal that is being sent, or he's not aware of what's happening on a smaller scale in the healthcare system.
Yeah, I mean, New York is so vast and you have so many different neighborhoods and communities. And if we have such high numbers in these smaller communities, then there has to be something wrong, right? How do you have upwards of 2,500 deaths within, these radiuses in Brooklyn, Brooklyn, the Bronx, and Queens, also Coney Island, if people are being tested. So somewhere the information is, maybe it's not reaching people on the ground or the everyday
Right.
people that I come in contact with, but um, I think there's something that's missing in those calculations.
Right. And talking about the disadvantaged in terms of persons who are at disadvantage because of their demographic or in terms of their economical status. For persons who are minority or undocumented immigrants, are they at a disadvantage when it comes to testing, diagnosing, and their lives being saved?
Definitely, even the CDC has a report on the disparities of race and what that has to do with healthcare, and as far as being seen and being able to go to the doctor when you want. As you know, if you don't have healthcare, it's a little more
Right.
challenging. Some people have to just go to the emergency room to get care instead of their primary care doctors. So it makes a difference, because a lot of it's affecting people of color a little bit differently.
Right. For persons who, I know a lot of flights, especially international flights, are not happening right now out of New York or out of the US, period. But as of last week, International Volunteer Coalition and Coronavirus Group has listed Jamaica and Cuba as two Caribbean countries closer to ending their respective national COVID-19 outbreak. Would that be something of comfort for persons who wish to book their vacation at a later date? Are they willing to travel again, and how soon?
I think the majority of Americans are still uneasy about traveling. I haven't seen anybody talking about going anywhere, anytime soon. People are still cautious. People still want to make sure that when they get on these airplanes that they're safe. And social distancing on an airplane has been a big topic here, because we were seeing some flights that did not have like empty seats between people, and some people didn't have masks. JetBlue, for sure, they want everybody to wear masks now on JetBlue. So I don't get the feeling that people are ready to go vacation just yet.
Well, let's talk about in terms of the economy overall. What's the information you hear on the ground as it relates to how bad is this affecting the economy and businesses, especially in New York?
The economy is not doing well. I was reading an article. I'm going to cite Forbes magazine, and they did a synopsis of the job loss, which is 36 million here, and they have the recession levels, which is once the unemployment levels reach 20%, it's a recession. Right now, we're at 14, and they predict that 42% of Americans will not get their jobs back. So, and for small business, it's really damaging, because right now, anything that's non-essential has to be closed. So you have the little small businesses who are really suffering, and a lot of them will never open their doors again, which is very unfortunate.
Well, that's very sad. Also, Governor Cuomo says beaches to reopen for Memorial Weekend, but based on the number Are persons prepared to go to the beaches? I know the past week, persons are going to parks, they're taking a walk on the beach. Would you advise, based on what's happening there, is this advisable?
Me personally, I wouldn't advise it. Like I said before, I think people have to use their common sense. They have to follow the doctors, they have to follow the scientists, and follow the research more so than saying, hey, I just want to be outside because it's nice. You have to think about your fellow New Yorkers and wear a mask. And some people are not even adhering to that. So I think people are just so tired of being in the house that they're not thinking rationally. And, I would rather save my life today than, be outside at a bar or a beach or a picnic. I think your life is worth more than that. So I think some people still aren't taking this seriously.
Right. And based on your personal experience with seeing persons with suffering from the virus, lost friends from the virus, what would be, as we close, what would be your recommendation to family members, to friends, wherever they are, because coronavirus is affecting the entire globe? What would be your advice based on what your investigations have shown and your personal experience?
My advice would still be to follow the data, listen to Dr. Fauci, listen to what the science is saying, listen, and just use, like I say, use your common sense. And it's really hard to actually be quarantined, but you have to think about, am I going to sacrifice today for tomorrow? I also lost my aunt about 2 weeks ago, and it's very, it's very painful for the families. And I just want, people to try to make sure they, look out for their fellow man, and then, help where you can.
Wow. Thank you so much for joining us today, Chante, to just shed some light for our viewers, because there's so many of our viewers in Jamaica that have family members in the US, especially in New York, Florida, California, all over. So we are so appreciative of you to join us this afternoon to share and shed some light on what's happening there in the US. Thank you so much, viewers, for joining us this afternoon. Thank you so much for giving us the opportunity to give you these information so you can educate yourself and be informed. As we always say, stay home, stay well.
Jamaica Weekly, the voice of Jamaica, is Jamaica's newest and most exciting full-color tabloid newspaper, packed with news, sports, entertainment, and a whole lot more. Jamaica Weekly is free and is distributed every Thursday to businesses and consumers island-wide. Pick up your free copy of Jamaica Weekly today at major retail outlets near you, supermarkets, pharmacies, and service stations. For more information, call 876-616-3031. Jamaica Weekly. Pick up your free copy today.
Need cash? WhatsApp Rapid Loans at 876-403-8048. That's 876-403-8048. Quick loans until payday. All you need is your ID, proof of address, 2 payslips, and a job letter. No security required. Loans for rent, utility bills, medical